It definitely is best to have a PT who's familiar with EDS, who's familiar with hypermobility. And that's not easy to find. Um, I mean, I have PTs that I know about have just through trial and error and through patients saying, hey, this PT's been very good. And then I send more patients. And then, this PT has a clear track record of doing well. I'm certain that there are other PTs in my area. There may be a PT down the street from where my office is who's excellent, and I just don't know about them. There's no, good way to find them. For, by and large, more and more PTs, a lot of PTs are certainly aware of hypermobility. They may be the ones you point out to a patient who's there for PT for another reason, that they are hypermobile, but they don't necessarily know how to the best ways to help somebody with EDS. They may or they may not. So just the PT saying, well, I'm familiar with EDS isn't necessarily a good enough criteria. And so in a perfect world, if somebody's near a PT geographically, who's one that, I know has a good track record, I'm going to prefer that they go to them, all other things being equal. If somebody's visiting from out of town or visiting from a part of the state where I don't know someone, then it gets tougher. Sometimes it's helpful to have them meet with a PT who's very familiar with EDS and kind of do an intake and give them some guidelines, and then sometimes they can work with another PT near them, or they can do things on their own, or they can work through telehealth, or there's a hybrid approach.